This lake is solid ice, at least on top. When the temperature outside drops to a certain level, the H2O goes from a liquid state or a vapor state to a liquid state, and then at the right temperature goes from liquid to solid, which is ice. You can check out online other people's blogs as far as H2O and its three phases, but the reason I'm bringing that up is a lot of people experience rashes and itching in the wintertime, and hopefully I can explain why that happens. If the temperature's cold out, regardless if you're wearing a jacket or a scarf or not, if the temperature's cold out, moisture and humidity is down. If that happens, then technically you're not going to moisturize the outer layer of skin. Skin is one of the largest organs of the body, and when it is supposed to do its job and protect, it's supposed to stay pliable and soft. You can't do that when there's no oil or moisture around. And my average patient that gets through the summer without using moisturizers and using very strong antibacterial soaps without moisturizer, they might be dry in the summertime and tolerate it, but in the wintertime they get worse and worse. And usually it's very slow onset. They'll start as a little dryness, they'll manifest as a little itch, and suddenly they'll come in with this rash, irritation, almost like an allergic reaction to something, but yet the history is negative for any kind of exposure of food or drug. And I would blame it on the excessive dryness that just accumulates. So in Chicago, you go from this cold temperature with low humidity to an inside environment where you'll have the heaters kick on, and when a heater kicks on, it usually kicks on with, you might have a humidifier built in, and the humidifier might say that you're at maybe a barometric humidity of 87%. I'm not sure of the exact measurement, but even if the humidity in the house is acceptable, you still have to be exposed to that environment out there. And the other thing also is no one who's trying to save money and decrease their gas bill will keep the heater on all the time. They'll set it at a low rate. So when you wake up in the morning, if it's cold, what do? You take a hot shower. The hotter the shower, and then again, these are especially my guys that use those antibacterial soaps, the hotter the shower, the more the oil is going to be leaving your body. It certainly feels soothing when you take the shower, but unfortunately, after you get out, if you're not in the habit of using a moisturizer, your body now has lost all of its oil or most of its oil, and then you put your clothes on in due time, and then you get exposed to the outside. You have this brittle, dry, ashy skin, I guess you can call it. That sometimes gets to a point where it sets up the body for almost like an irritating reaction. And in some cases, the body will think it's an infection or an attack. So white blood cells are sent to the skin all over, and you'll see these rashes start. Bumps, redness, all because of dry skin. And now, if you go to the immediate care center, you always have to rule out exposure to toxins, drugs, foods. But if all that, or even strep throat, and if all that is all negative, and I have my average guy that comes in looking excessively dry to the hands or the back of the arms, maybe a little dandruff, and they have this rash all over and I can't find a source, I'll blame winter itch. It's kind of like an atopic dermatitis or an eczema that occurs in the wintertime. So the idea is, if you're going to be not using a moisturizer in the summer, you really have to consider using a moisturizing soap. And soaps are either with good oil in it, like moisturizing soaps, or oil cutters, like antibacterials. So try to move away from the antibacterials and more into the moisturizing soaps. Dove White Non-Perfumed, for example. Those cutters, the antibacterials, are good for taking care of infection, but they also take away a lot of oil, so try to avoid them. Try to steam up the bathroom before you step into the shower, so that at least it's warm. And then right before you step into the shower, turn down the heat a little bit so it's comfortable. Maybe have a heater in the bathroom, especially with kids. If you can also get into the habit of using a moisturizer. Usually if you look for moisturizers with ceramides, I'll put a link and you can probably see it online, but those are agents that help to repair skin, keep it moist. There are some dermatologists who like using retinoic acid. I think it's too aggressive, and really, if you can't find any of that stuff, just get into a habit of using a moisturizer from toe to head after your showers, after you've toweled off. And I have a link to how to use oil to the body, Abhyanga it's called. In the same fashion, you can certainly use a moisturizer and get two actions out of one. Not only are you going to moisturize, you're also going to do that self-massage that helps with energy and healing. So I'll put the link for the Abhyanga video I did before. As far as your choice of moisturizers, again, stay away from the perfumed stuff. Try to go with, you will pay top dollar for the better moisturizers, but I wouldn't necessarily go to bargain basement stuff, and make it a habit every single day, and soon you'll see it reverse. Staying hydrated, always important as well. And then especially with the hands, because we all wash, especially in the health profession, we wash all the time between patients. You might have to have moisturizer available between patients. I usually rely on oil, and it's your choice if you have oil around versus moisturizer. Moisturizer is great right after soaping up and drying off. Oil, I think, is even better, but it leaves a slippery feeling. I mean, that's the reason for it, it's oil. So you make your choice, but it's essentially taking care of the body, replenishing hydration, getting ready for the ambient temperature outside, and then the heaters that are kicking on the inside. You know, even if you do well with your house and keep the humidity at a good level, your work is not going to be concerned. The average industry or office space is not going to be concerned about moisture or humidity, and it'll just be spouting out dry heat. So 8 hours a day, you have to at least prepare for that. I had a dad call in the other day after we treated him, and he was asking, why are the rashes coming back after 4 hours of Benadryl? And he was expecting that one dose of Benadryl would wipe the rash out, or the rash that was showing up on his kid, wipe it out and not have it return. What I had to educate him on was, with that child in particular, it was an allergic reaction. Allergic reaction to something. I couldn't prove or disprove what caused it, but I could tell him it was an allergic reaction, most likely. So usually the body's going to manifest a reaction, and it's going to continue with the reaction. Our best bet is to control the symptoms with Benadryl, steroids, topical steroids, relaxation, moisturizer, and no further harm. So the reason I'm mentioning this is because when pushed for a diagnosis, we try to make the best educated guess as far as what caused their rash to start. Most rashes, when they begin in the first couple of days, will be about the same no matter what the reason. Now granted, you'll have your zoster, or you'll have your chicken pox, you'll even have molluscum contagiosum. Those are classic. The way they present even in the first day, they're classic, and a doctor or a trained professional can make a diagnosis like that and come up with a treatment plan. But the majority of other rashes, whether eczema or allergies to food or viral exanthems or strep infection rashes that come out on the skin, they're called Pastias lines, even other rashes that could be from drug-induced reaction. They all will usually start out about the same. And if you come into the doc's office during the first couple of days of evolution, it might not have blossomed into its telltale signs, the textbook signs. So what do? We try to make sure there isn't anything else going on, and we say, well, we'll try to treat you as best as we can, but keep on coming back so the doctor can reevaluate. My usual suggestion is you take a picture of the rash on day 1, and you continue to take pictures every day so that the doctor that sees you on day 5 will know how it looked like on the first day. If you have to go to an urgent care center or emergency room and you get a diagnosis, you should still take a picture, because your follow-up doctor, and there always has to be a follow-up doctor, will want to know what it looked like the other day. And if you just say, well, it looked rashy, that helps nobody. Doctors will always be able to tell what the diagnosis is when we see the rash in evolution. It'll be a pain in the butt to keep on bringing your kid or bringing yourself into the office every couple of days, but this is the way we determine rashes. Sometimes we can do biopsies, which are important if this is a chronic thing, but we're not going to go, I wouldn't cut into everybody that comes in with a rash when we still have to see what happens, especially if the suffering is on the low scale. If you have somebody that's losing time from work or suffering from severe headaches, joint pain, sore throat, cough, then it's worth it to investigate the rash more aggressively. Or look into other things that might give you a diagnosis. If you say look into the chest, look into where they visited, blood tests in particular. But the bottom line is most rashes will start out about the same. So if you can take pictures, great. If you can't, description might be helpful. Be prepared to keep on coming back to the doc for evaluating. When we use medicines to control the breakout, it only does it temporarily. So the side effects, unfortunately, of Benadryl are sleepiness or sedation. The side effects of prednisone are being hyper, not being able to sleep. There's other medicines like topical steroids of different strengths, mild, moderate, and potent. It depends on the age group and where you have the rash as far as which one we like to give. And usually most physicians have their favorite. Then there's the other things that you do. Hydrate. My previous video I talked about how in the wintertime, in most places up north, excessively low humidity, so it causes more dryness. Hydration, proper moisturizer with cetamide in it, sometimes even using a very strong or potent steroid first and then backing off and using your usual oils or cetamide lotions, sometimes even Tazarac or retinoic acid would be important to take some of the slough, the skin flakes away. Taking care of the scalp as well with anti-dandruff shampoos will help with the itching. And by all means, if you see somebody with a rash going like this every 5 minutes, cover up the nails, cut the nails, remind them not to scratch, or just tell them, here's your ice pack, get the ice pack on the area that's irritated, don't scratch it, because it starts up a cycle of rash, irritation, histamine response, and what we want to do is calm down the histamine response and turn off the cycle. That's what Benadryl, steroids, other anti-inflammatories like Singulair, that's what they're all for. So, and staying away from any kind of stimulants. Caffeine is a no-no. Tobacco is a no-no. Sometimes alcohol can be a bad thing. And using medicines to calm. Using medicines at night to regain your sleep. Using herbs like St. John's wort or magnesium, 5-HTP. Those are all calming. They help as well.